Hello everyone, welcome to the world of NCLEX Rn learning. So today we will study how to instill or administer. So we'll start with the question. The nurse teaches a client with newly diagnosed Sjogren's syndrome how to self-administer ophthalmic lubricating ointment medications. Which statement that the client makes indicates the need for further teaching. Same like other topics that we have discussed in our previous videos. Here also the client making some wrong statement, or the way client is doing or self-administering this particular medication is not the correct way. So here also we are looking for a bad statement or a wrong statement. Option 1. After applying the ointment, I will tightly close my eyes and rub the lid for 2 to 3 minutes. Option 2. I will squeeze the thin strip of ointment on my lower eyelid from the inner to outer edge. Option 3. I will tilt my head back, pull my lower lid down and look upward when administering the ointment. Option 4. I will use my ointment at bedtime and my eye drops during the day. So these are the 4 options they given. What do you think which would be the right answer? Before choosing the right answer, we'll study some of the common steps or the steps of the procedure of application or the administration of eye drops or ointment. So the first step, same like everything, wash hands and or perform the hand hygiene. Then the second step, tilt the head back, then pull the lower lid down and look upward. Okay, tilt the head a little bit back, then pull the lower lid down and look upward. Then the third step, squeeze a thin strip of ointment onto the lower eyelid from the inner to outer canthus or inner to the outer edge. Then the next step, close the eyes gently for 2 to 3 minutes after applying the ointments. So these are the 4 small steps. This is the very important steps and it should not be any manipulation or any change in these steps. So if one who know these steps correctly, they can pick the correct answer very easily. So might be when you will see these questions, you might be wonder how I will answer because I don't have a clear idea about Sjogren's syndrome. Actually, Sjogren's syndrome, it is an autoimmune disorder in which client usually have a clinical manifestation of dry eyes and dry mouth. When we listen an autoimmune disorder, we know that our own immune system will attack the healthy cells. In this condition, our immune system or the client immune system will attack the healthy cells that produce the saliva and tears. So there is a lack of production and the client have the problem of dry eyes and dry mouth. So in this situation, that's why the doctor has prescribed for an eye ointment or drops to lubricate the eyes and moisten the eyes. So if you don't have a clear idea about this Sjogren's syndrome also, you can answer this question because the question is not something particularly about what Sjogren's syndrome. Anyway, when you read this question and you read the options, you understand this syndrome have some problem related to, or the client has some problem related to eyes when they are diagnosed with this particular medical condition. That's why the doctor has prescribed eye ointment. So you are clear with that much. Only they are asking what are the, might be for any other condition, anything it is, what is the right method or the right way to apply or the administer or installation of an eye drops. So that is the question. Now we already know what are the steps and we know what is this condition also. Now we will see what is the correct option. After applying the ointment, I will tightly close my eyes and rub the lid for 2 to 3 minutes. See, we have studied that after applying the ointment, the client should be gently close the eyes and should not do any rubbing. If the client is doing rubbing, that will cause further injury. It will cause injury only. There is no the effect of this medication. That's why this is the wrong statement. Might be when we will read until okay after applying the ointment I will tightly close my eyes. Until that area you might be feel it's correct. You seems like a correct option, but here there is a word and rub the lid for 2 to 3 minutes. Imagine when the rubbing that will cause injury only. So that is the wrong option, and that is our answer in this question. We'll see what are the other options, why that is not the answer. That's also the best way to study, because some other questions, the other three options, the wrong options would be the correct answer. So if you'll know why that is not answer in this question, in this scenario, it will help us to tackle other questions also. Second option, I will squeeze a thin strip of ointment on my lower eyelid from the inner to outer edge. That is our step we already studied. Take a small thin strip of ointment and apply it to the lower eyelid from inner to outer canthus. Then I will tilt head back, pull my lower lid down and look upward when administering the ointment. That is also the first step, the position for the installation of eye drops. Then the last option, I will use my ointment at bedtime and my eye drops during the day. That is, there is no misinterpretation, or there is no wrong connection with this statement. So that one also we can eliminate. So here the correct answer is the option 1. I hope you understand why the option 1 will be the correct answer and why other options are incorrect, because those are the correct statement, those are the correct steps of this procedure, and the first option only the wrong step or the wrong method of administration of eye drops. Is that okay? So this much for today. I hope it's clear for you. So prepare well, and all the very best to all of you. Bye bye.